we'll give it 2 more minutes and let everyone get in to the webinar, and then we will start in 3 minutes past 4 exactly. So we'll give it a couple more minutes. While we are waiting, I would like also to welcome Dr. Paulina, who just joined us.
Yeah. Hi.
Hello. Are you in New York or St. Petersburg?
No, I'm in Moscow. I have my vacation, so I came home.
Fantastic. Welcome. We are in so many countries now. So UK, Croatia, Jordan, and Russia.
Yeah, perfect. So I'm pretty sure we have a nice talk, and we have.
We will. Really looking forward. I'm really looking forward. Right. I will start the webinar if that is okay with everyone. I would like to thank you all, our speakers, as well as our participants and attendees for joining us to this webinar. It's another webinar of the Gynae Fellow series. We thought this is a good time to talk about some of the training issues. I owe this idea to my team, Daas, Aya, and Zainab, who had suggested this, and I think this is a fantastic idea to exchange insights and discussions about the training issues and pathways to different countries. We selected for this one the UK and the US as the 2 most popular destinations for international medical graduates, but hopefully in the future we will make this as a regular meeting, and hopefully we will expand more on more training issues to discuss. The webinar is primarily going to be moderated by 2 of our young Gynae Fellow team members, and these are Aya. So welcome, Aya, and thank you for accepting the invitation to moderate, as well as Zainab. So without, I will be around, and we'll look forward to listen to all our speakers, but without any further delay, I will leave the stage for Aya to introduce our speakers and start the webinar. Aya, it's yours.
Thank you, Mr. Al-Azam, for this amazing opportunity. Hello, everyone. I'm Aya. I'm a junior doctor who graduated from the University of Jordan in 2020. I've been a Gynae Fellow member since June 2020, and I will be your moderator for this webinar. It's an honor to be a part of such a crucial webinar for any international medical graduate that's going through a dilemma to decide what is next in their career. So in today's webinar, we will be joined by different speakers addressing important issues in regard of career paths and providing us with tips and tricks to pursue training in the UK and the USA. We are really happy to have you with us in this webinar. And please, if you have any questions during the webinar, post them on the Q&A section. And at the end of the webinar, we'll be addressing all the inquiries. First, we will be starting with one of our mentors, Dr. Uday Ali. Dr. Uday Ali has been a consulting gynecologist based in Cumbria since 2014. He completed certification on obstetrics and gynecology with training in colposcopy, oncology, and advanced laparoscopy for endometriosis in 2012. He's a Royal College tutor and is passionate about teaching, training, and simulation. Today, he will be presenting the topic Overview of Obstetrics and Gynecology Training Program in the UK, with tips for successful entry applications and interviews. We are very excited for your talk today. So Dr. Ali, can you please join us?
Thank you very much for this nice introduction. I'll be sharing my screen with you just to save time. Share screen. So I'll be 1 second. Yeah, that's the one. Share. I just go to the top of the. Excellent. So can you see clearly if that's. Can you see me well? Hello?
Yes, we can.
Yes.
Yeah. So I am sharing this experience with you. It's not easy to get the system of OBGYN. I had gone through several interviews and several applications. And I would like to offer you my experience and also my experience as a consultant who helped other people to get into the system. Through mentoring, or through reviewing their applications, giving feedback to their interviews, and I had recorded success. I encourage people to come into the OBGYN, and I'm proud of it. So I thank you, fellow gynae fellow, for this opportunity, and I'll share this slide with you. The first thing I would say that the journey to specialization has two parts. Either you become a hospital doctor or a GP, general practitioner trainee. So for the hospital doctor, it's a long journey. It starts with the medical school of 5 years, then following medical school, you got foundation year 1 and 2, where you augment your skills of communication, basic skills. There are 35 competencies you need to be signed for before you come to the structured training. Sometimes people go to core training, especially in surgical specialties, anesthetic, medicine, not necessarily in OBGYN, and that can take up to 3 years, where you are ready for the final destination of structural program. For the obstetric gynecology, the structure program, if you are efficient in passing all the stages, is 7 years. Some specialties are 6 years, like psychiatry. Some specialties are 8 years, like pediatrics. There is a talk about prolonging the training, but still not sure. If you want to prolong the training by adding more skills, you can go for subspecialty for 3 years, or sometimes you interrupt your training or you flavor it with research, and this can take you to another 4 years. So the whole training will become 11 years. There are certain applications specifically for academic pathway from the start, which can take you to 11 years before you specialize. If you compare that with other countries, this is a long training. If you are from international, if you are international graduate and you come to the United Kingdom, you can enter the training system through what you call a certificate of eligibility for structured training, or the combined route, where you, at one point, your skills are adjusted, and then you carry on training in the system. So just give you an idea about the United Kingdom training. It's divided in regions. To start with, the Scotland application is different from England, Wales, and North Ireland. So if you are interested in going to Scotland, they offer very good training, then it is a different system, different application. But for North Ireland, Wales, and England, the areas of training are divided according to geographical territory. For example, there's the Northern Deanery, which include Newcastle, Durham. There is Wales. London itself has training territory. There is the Wessex, where I trained. In this territory, there are hospitals which are linked in this training system. And usually people rotate from hospital to hospital, and generally travel expenses are covered. And there are variations in the mix of skills that is offered in that deanery. For example, in Northern Dennery, they're very heavily laparoscopic. We have cadaver course in Newcastle, comparing to other deaneries where are in London, for example, they're exceptionally good in fetal medicine research, so and so on. There is definitely assessments and exams you need to pass. These assessments are yearly. They are important, and to pass from one training year to another, you have to be successful. We call this outcome one in the assessment, and that relies on many aspects. If you want to move deaneries, it is possible, but it's not that easy. You have to have a good reason to move from one deanery to another, and usually people do it for family reasons, and it is an application. Yeah, sorry.
Sorry to disrupt you, but your slides are frozen. Can you put them on this slideshow, please?
Yes, no problem.
Thank you.
1 second, I put on slideshow. Are you happy if I do it this way? Are you okay if I do it this way?
Yes, absolutely, yes. So, but we just want to follow up the slides with you. Yeah.
Yes, yeah. I think that will be easier because of the lag. So just to come to OBGYN structure training, there are certain bottlenecks in it or certain joints in it. The first 2 years, which is called structure training 1 and 2, where people just starting the training, they are first on call. They basically requiring to acquiring the skills of examinations, for example, finding the station, cervical assessments. Sometimes you step into skills like lift out, deliveries, opening the abdomen, closing the abdomen. By ST2 to ST3, you should be ready to be second on call. And also, it's important to pass your MRCOG 1. And I've seen people delayed at this step where they can't pass the MRCOG 1, and that can be a problem. So by ST2 to ST3, people are ready to be taking a leadership role in managing emergencies as a second on call. So ST3 is a very important stage where people should be confident in instrumental deliveries, cesarean sections, not so much to do laparoscopy. I think this will change in the future, but labor ward skill are very important. This is because sometimes ST3 stays in the hospital as the main person in labor ward. And from ST4 to ST5, you just augment your skills where you can do more complex cesarean sections, 34 weeks or twins, and sometimes you step into placenta preview. By ST5, you should be mature to lead labor ward, make decisions, and also you need to think of the next step, what you want to do, what sort of modular training you need to take. So by ST5, people should step into the MRCOG 2 and 3. If you clear it, that's good news. Your journey is smoother. If you don't clear it, there will be, generally speaking, there will be problems. So the training can't be terminated after 3 attempts. And I've seen this happening. So from ST5, you've got 2 years to finish 2 modules. Usually, most of deaneries, they encourage you to do 1 obstetric and 1 gynecology module, where this is sufficient to finish a certified training. Some people want to do subspecialty training, which can take you to 3 years before you're awarded the completed training. That's an overview of the structured training if you are basically focused to finish it as early as possible. So I go to the next one. So I'll just say a bit of talk about advanced training modules. So in the ST6 and 7, you got training modules, as you can see on the top, from abortion care to acute gynecology to advanced labor practice, medical disorder pregnancy, oncology is one of them, menopause. So these training modules, you have to pick very well. You have to basically prepare a logbook. You need to have 2 preceptors. You need to do an audit. It's mandatory to take a course of the Royal College. It costs usually 500, 600 pounds. And you have to have them RCOG. And also you have to have a lot of paperwork, including reflective practice. Now, I want to say from my practice, if you are taking advanced training module, you need to think of the type of you are going to land in. So for example, if you want to do oncology unit lead, you need to think of oncology, colposcopy, and labor ward. If you are thinking of running the early pregnancy unit, you need to think of acute gynecology, advanced training module. So it is really important to plan your future consultant job. And sometimes future consultant jobs are very prescriptive. One of the essential requirements is you need to have an ATSM tick box as one of the tips or one of the requirements for being shortlisted. Otherwise, you need to defend how come you are going to apply for this consultant post if you don't have the advanced training module. So that's really important. So coming to the subspecialty training is a very competitive. You've got 4 subspecialty: oncology, urogynecology, fetal maternal medicine, and subfertility. In subspecialty, usually there is a requirement for a research element, 2 publications. One of them is first author. So you are taking your skills to a very specialized level. It can take 3 years, and it is basically, if you're in oncology, you will be operating 3 or 2 times, 2 days a week, and you are exposed to very advanced skills. And at the end, you'll be subspecialist, and it's a special certificate awarded by the General Medical Council, in addition to the completed certified training. Subspecialty has the risk that it will narrow your options in future applications for a consultant post. So if you are subspecialist in oncology, you cannot go for a generic job. So you have to think really carefully. If you are going for subspecialty, you are really narrowing your options of consultant post to a center or academic center. But it's good and it's rewarding, and it is very competitive. Sometimes people go to subspecialty after the training is finished, but this is getting very rare at the moment. Most people go to subspecialty from ST5, ST6. So you've got a narrow window to prepare for it if you are aiming for it. Now, this is very busy slide. I'm going to summarize it for you in the sense that research is encouraged, not disencouraged. However, it does prolong the training. So you can enter the program from the start as academic program. So you are academic fellow from the start, specializing in one of the areas. Usually, it is prescriptive. You are going to be, let's say, subfertility specialist from the start, or urogynecology from the start, or you start your training and you interrupt your training for a PhD, and you are allowed out of program experience. It can be for 4 years in a different place before you're coming back to your original training board ordinary to finish your training. It is rewarding, however, it's also demanding, and it can prolong the training, and it can put you in a better position when you finish. So you are attached to an academic center or university, or you become a lecturer, and it is interesting and rewarding. Sorry. So I want to say something about certificate of eligibility of structured training. This is really important because for international fellows who finish their training at their homes and they are certified, they are consultants in their countries, they come to the United Kingdom and they want to be working as consultants or aiming for consultant post. So most of the cases, the training is recognized, given you got good evidence of equivalent skills. You have to be really robust with your paperwork and check Royal College and GMC websites for eligibility, and your skills can be transferred. Most of the cases, it is successful. Sometimes your skills are adjusted at a certain level, and then you carry on training. The entry for the training program is not going to be from ST1, it's going to be from ST3. So, and the other thing that some people who are training in the UK were not successful in getting the training system, they end up doing clinical follow or non-training jobs. They can keep a record of their skills, and again, they can apply for this pathway. So their experience in their non-training post are still useful for their application. And majority of the cases, experienced people will be adjusted after a year, and this year is important so you can prove that you are worth the training, you are efficient, and your documentation is good, and most people acknowledge your skills. And the advantage of international trainees, like people coming from, let's say, Egypt or from India, they already have good background in obstetrics, which is really important skill. So they are not struggling with instrumental delivery or managing obstetric emergencies. So they are comfortable in that regard. So my tips for successful applications is that you need to think of these items really, really carefully. The first item that I'll ask you about audit and quality improvement projects. So when you write your application, you need to be really specific. You don't fill the text with good words like audit is excellent, important. You need to prove that you've done an audit with an output. Ideally, you led on it. Ideally, if you have led a quality improvement program, you'll score higher than somebody who was just part of an audit. The other thing, you got presentations, you score higher. So if you paid the money before the COVID times, you took the effort and traveled and presented, you put an abstract in the RCOG and it is a publication, that's really good. Publications is the weakest link of the applications. Only probably 40% of applicants have first author publications because it takes time to publish, and also it's one of those things that you can improve on as you are in the training. But they definitely score higher. You need to prove that you have participated in teaching and what sort of modality of teaching. Again, be specific. Research is also important. Be part of research. The thing that you can do easily is to collect courses like emergency obstetric courses, ultrasound courses, minimal access courses. Of course, if you got prizes as a medical student or as a trainee, as a doctor in your placement, that will be really good. And one of the important things is to show commitment to your specialty. What do you mean by commit? What does it mean to have to show or demonstrate commitment? It means you already acquired some skills in that regard. You already applied for the MRCOG before the application. You already got the MRCOG, or you already cleared it before the application. And that scores really high, means that you are going to be useful addition to the trust. And also to include some management in your application, like running the rota or be part of a governance meeting or something like that. So my tips for successful application is be specific. There's nothing general here. It's about you. You need to have something eye-catching, like if you publish about or you do work about enhanced recovery in minimal access surgery or wound infections in obstetrics. I'm just giving you some examples. You need to have some vision. I want to do obs and gynae because I'm passionate about saving women's life. Also, you need to have no typos, absolutely no typos, good English. And you have a lot of help before you put your finger on the send button for the application. So I want to say why obs and gynae. This is really one of the important things you need to answer. You need to have a good answer for that. Why you pick this specialty. The specialty does rely on teamwork. In obstetrics, in gynecology, you are part of a team. In comparison to dermatology, the team element is not as important. You rely on theater nurses to help you with the case. You rely on your midwife colleagues to manage cases. You rely on your colleagues to manage emergencies. So teamwork, team function is really important. You also need to think of leadership. At the end of the training, you're going to be a leader in your field, in your hospital. So this is the ultimate thing of the training, is leadership. Now, this specialty is dynamic. It is physically demanding, so you need to keep an eye on your health and to have like balance in your life between your family, yourself, and the specialty. So you need to take care of your health regularly. Also, you need to understand this specialty has an emergency element to it. So there is on calls, there is nights. So part of your life will be spending, as on call, and maybe called in the night to solve a problem. There is also surgical side to it. There is beautiful procedures. There is obstetric procedures. There is gynecology procedures. Now things are heading towards more minimal access, and also there's diagnostic element. There's a lot of involvement of scanning, and it is evolving field. So it is really wonderful specialty. When it comes to the interview, I want to say that if you pass the threshold of shortlisting, the process will be you'll be invited for an interview, which is usually structured, descriptive. It does involve a station, and it is timed. So you will be moving from station to station, given 15 minutes, because there are a lot of applicants like you in the process. And they will go through the record of the training you had. You tick all the boxes in that regard. They will be assessing your communication, your English. They will be assessing your competences. They will be assessing your professionalism. And they will be assessing your ability to clinically prioritize, which is really important skill, and especially in obstetrics. And also, what have you done in the governance process? My advice is to be really specific and try to answer this question: why I should pick you for this training program? Why did you pick this specialty? And try to answer as well, why did you pick this location? And what's your vision over 5 years, 10 years, 15 years? What do you want to do? So you are committed to this specialty from day one. So in summary, for successful application, try to clear your exams. Having the effort to clear the exams or part of them does put you at great advantage before the training and during the training. You will be called Miss or a Mister from the start. If you can, recruit your resources, take courses for it. For overseas doctors, I do encourage networking and some time to attach yourself to a unit to observe how it works. Also try to take as much courses as possible in scanning, minimal access. The whole college is full of courses. They are expensive, so let the money serve you here. These courses are not cheap, but they are valuable. They give you also a chance to network, know people in the college. Use your attachment, even if you're not in training, to do a project. You need to produce an audit, be efficient. Sometimes you take a project and you don't finish it. Try for something that you can have an output from. Try to be present in the Royal College meeting, conferences, or the societies, the British Society of Endoscopy, the Colposcopy Society, British Society of Colposcopists. And there are a lot of meetings. Now, it's easier maybe being virtual, but try to take the effort and present. Also think of extracurricular activities that makes you stand out, you know, like charitable or charitable work. You run the marathon. You did something that is not necessarily medical. Now, you need to think of your application in two forms. You can win an application by volume of work you've done, or also the quality. You need to talk about yourself in numbers. I've done like 50 cesarean sections. I've done this number of audits. So that's really good way of presenting yourself. I want to say one thing about international applications, that when you come to the United Kingdom, you need to also understand the culture, the work environment. There's no hierarchy, so we work in a team. So the midwife is your colleague, the nurse is your colleague, and it's very important to show respect, to understand the language very well, improve on the language. There are bottlenecks in the training, if you are in the training or going for the training. So sometimes you see a negative work environment, and I encourage you to go into the Royal College to look for the new publications about how to improve work environment and how to handle bullying. One of the things I noticed is incomplete projects. You start project, start, you don't finish it. And it does cause a lot of loss in your time, in your effort, in your score. The other thing I noticed is deficient paperwork. So when you come to your application or during your training, you come to the assessment, you haven't done enough, you leave it to the last minute, you run around, you take off sick just to finish the paperwork. That's not the way. The people who have produced excellent paperwork, they pass through, and they are actually wanted, they are actually hunted for the training opportunities. Communication is exceptionally important. To have advanced communication skills, it's part of many specialties in OBGYN, including oncology, early pregnancy units. So having training in that regard, modeling, exposure in the clinics is really important. Now, also one of the bottlenecks is family, having pregnancy, getting married, moving for family reasons. It does affect people, but the training does offer you a lot of support in that regard. The other thing also I noticed is stress and health issues. I sadly mentioned that when I was training, there was a suicide of a doctor from stress in where I train. So it's very important how to take care of your health, physical health, mental health. OBGYN does sometimes cause stress in the sense that the job is intense, the on-calls, we deal with dynamic emergencies. So I want to say why I recommend the United Kingdom for training in OBGYN. One of the main advantage of training in the United Kingdom is English. So English is the #1 language in the world. So you know, if you go to train in other countries, you have to go across the barrier of, for example, you want to train in German, you have to have a year or two to train and to be efficient in the language before you get into the system. And also, I want to say that national health system is the biggest employer, and it is wonderful. It has its own system of accountability, efficiency. It struggled with the COVID, but it proved itself in the COVID. And also it offers great opportunity for continuous development. It's a system I'm proud to be part of in comparison to insurance systems. The other thing I would say is the Royal College is an excellent body of knowledge, in the sense that it produces excellent guidelines. It's a leading in a lot of aspects, especially colposcopy, obstetric. And also, from my training, I would say it is an excellent training. It has produced a good doctor in me, a good surgeon. The culture is accommodating and forgiving and welcoming. It's multicultural. You have to master good English, really, the language skills. I can't underestimate their importance. Also, in this country, I feel safe, I feel protected. I can walk in the night when I finished my shift. And also, one of the things, it is very regulated. It's regulated at many joints, including the yearly assessments. In order to keep your certification, you need to do a certain number of procedures or courses. So it's one of those things that is part of the system. I want to say the three important things, which is the 3 C's, that you are going to be judged on. In summary, you are going to be judged as on your conduct. You're a nice person to work with. You're a nice person to have in our unit. The other thing is about your communication. You talk really well. You communicate. You have this good element to your personality, in addition to your competence. So it's not enough to be really skilled surgeon or skilled sonographer or skilled in your obstetrics. You have to have these 3 elements together, and you are going to be assessed on them yearly through the appraisal, through the annual assessment. At the end of the talk, I would like to say thank you to Gynae Fellow, and this is the email if you have to pose any questions, and I'm ready to answer any questions at the end. Thank you very much.